We're going to go into some things about nerve pain, nerve issues. Before I do that, I want to cover that you might be feeling a little bit of relief today over the last couple days, and that's great. I hope you feel a lot more. What I want to say is if you're not getting the results you're looking for, it's not that things aren't working, it's probably that they're not getting enough time and enough repetition. So make sure you're consistently doing those things. Ice, heat, make sure you're stretching daily, multiple times a day. Make sure you're moving through those ranges of motion. Make sure you're doing those stretches. Building those things, doing them consistently is going to help get you the results long term that we want. Okay? Now, there's going to be things we're going to be able to look at and see in our office that measure nerve interference and where that's coming from and how that could be affecting you. But if you're dealing with neck achiness, pain, things, and especially if you're having tingles or the zingers they call them, or pain or numbness into the fingers, into the hand, that's something we really want to address. That's telling us that there's actually direct pressure on a nerve, not just inflammation and swelling. Okay. So if you have that, this is for you. If you don't have that, this is still for you, because what this is going to do is help those nerves to work better, which is going to help control those muscles and going to help you to move better and function better overall. Okay. So simple, as simple as we can make it, there are three main nerves that run down your arm, okay? Your radial nerve, your median nerve, and your ulnar nerve. Those three nerves are going to control all the muscles, and you're probably going to, if you're having those symptoms, you're going to be feeling those directly. You might say, oh, certain fingers are numb, tingly, stuff like that, okay? What we're going to do today is called nerve flossing. So those nerves, they run, they're like a big bundle of strings or like a wire. They have a sheath around them, and that sheath, those nerves actually slide through that sheath, and so as they slide like they should, that's fine. Sometimes we can get adhesions, or there's scar tissue built up basically, where now those nerves don't slide as well through that sheath, and so that can cause the irritation and the pressure and the inflammation that can be causing your symptoms. So what we're going to do is walk through what they call nerve flossing. Don't worry, there's going to be a PDF guide kind of walking you through how to do these, because following the video is great, but a visual could be extra helpful. Okay. With nerve flossing, what we're going to do is three simple movements. The first one's the most basic, and that's for the radial nerve, which is going to be a lot of your thumb and your index finger here. What we're going to do is we're going to have our hand all the way out, and we're going to be palm up. When you're with your palm up, hand out, elbow straight, you're like only going to bring your fingers down. You're going to bend at the wrist. You're going to bring those down, and when you do that, you're going to tilt your head to that side. We're going to come back to neutral, and we're going to repeat. You want to think about a string from the tip of your finger to your head. And as we lean, we're moving them together, and we're coming back. And we're obviously going to do that both sides. Even if you don't have issues on the other arm, do them on both sides. It's just good for you. We're going to do that. That's the first one. The second one is for your median nerve, okay? And that's going to be a little bit of a different part of the hand and some of the middle finger. What we're going to do here is that we're going to bring our hand back like we're doing, they call it the waiter's tip. You walk away from the table, stick your hand out back, you walk away hoping to grab that tip. That's what we're doing here. We're going to have our hand, we're going to bring it up. When we do that, we're going to have our head tilt to the side. That's going to stretch that median nerve, okay? Or floss that median nerve is a better word for that. So that's the second one. Our third and final nerve is the ulnar nerve, and that's going to take primarily the pinky and the ring finger here. Now that is going to look a little different. This is probably our most complicated one. So if you can remember being a kid, you probably took your fingers like this and you went around and you made a little Batman mask of yourself. All right, we're going to do that here. So we're going to take that hand that's affected. Again, we're going to do the other side. We're going to bring that hand up. We're going to bring our finger around if we can, and we're going to come here. Now, if you have shoulder issues, wrist issues, things like that, that may limit this movement. Just do as much as you can, okay? With nerve flossing, some people, they really feel that nerve sliding, and you might feel a tightness. We don't want to do things that cause pain. We don't want to do things that cause zingers or your fingers start to go numb. If that's the case, there's some deeper issues going on that really need to be addressed and checked out through an x-ray and an evaluation. But if you aren't having a lot of that when you're doing these movements, those are a great way to really move those nerves and floss those. I've been Dr. Nic Mueller. You guys have been awesome, and I look forward to helping you, seeing you more, and spreading the word.